Hi everyone, this is MN669 Journal entry number 10, my final journal entry, and I just have a few questions to reflect on during this entry. The first one being, what goals did I set for myself at the beginning of the semester and did I meet these? Well, one of the biggest goals that I set was to have a better understanding of pediatrics and adolescents when it comes to mental health and also the different types of treatment plans. And I do believe that I did accomplish that goal. Understanding the process of many of the disease processes that affect, pediatrics, not just pediatrics, but they do affect adults, but getting a deeper understanding of ADHD, autism, obsessive compulsive disorder as as you see it in children, just different things like that, and knowing how to address these, like what medications are going to work best for them, how to accomplish these goals. Also, looking at child interactions and just when giving, sessions, like how do you interact with kids so that they build that trust level. I feel like I did get a better understanding of those, and that was definitely a goal that I wanted to accomplish. The second question is, what feelings, prejudice, bias did you experience during your clinical experiences, and how did you manage them? To be perfectly honest, I went in with an open mind, not knowing what to expect, so I don't feel like I had any bias. So I don't feel like I really had anything to accomplish. Like, I didn't necessarily have any bias or prejudice other than, maybe kids like doing recreational drugs, or maybe like, the whole teenager experience. That might have been like the only bias, just from being a parent and, having that firsthand knowledge. But other than that, I really didn't have any. But I would say that would probably be my number one that I conquered. So the next one, how did you manage your anxiety, self-doubt, and uncertainty? I would take walks during this time to decompress, or might take a drive to decompress, because it can become a lot, especially with dealing with children. Just hearing their stories, and a lot of times they can be heartbreaking. So the next question is, what understanding or insights did you develop during your clinical experience? I will honestly say that understanding the medications, care plan process was a definite learning curve for me. Like, I really feel like I had a better understanding of how to process those, especially with children and adolescents. The next question is, has reflective practice impacted you as a person, student, and or provider? If so, how? I feel that reflecting does help, because it gives me an opportunity just to look back and, see like how could I do things better? What mistakes, did I make? How can I, improve during the next session, or throughout my clinical practice, or when I do become a provider? Like, what tools can I use to definitely, using reflective, I think that this is a tool that I can use just for improvement purposes. Okay, and the last question is, will you continue to use reflection for your future practice? I think I will, because it allows me an opportunity just to evaluate and critique myself, evaluate, and to also use this tool if I'm able to use it for other patients, looking at, just improvement process. So I'm always about improving, or improving in any ways that I can. So I think that's it. I hope everyone enjoyed my series of my journal entries this semester. And that's it for MN669. Have a great day.